I'm Dr. Sreenivasa Murthy TM. So, does a natural organ require treatment? Obviously, it doesn't require any treatment. So, a natural organ which can get infected with a virus generally requires only supportive care, wherein we will be giving, if the child has fever, something to control the fever. Child has running nose, nasal obstruction, so give nasal decongestants, some saline, some antihistamines, so that the running nose stops. So these are basic supportive therapy. But if somebody has a bacterial infection, obviously the child will require a course of antibiotics, which will be decided by the doctor based on various different factors as to what would suit the child best with respect to the antibiotic of choice for that particular infection. Do we have natural therapies? So obviously it's a wrongly worded question. Many of these infections are self-limiting infections. You can have a natural course wherein the body itself can heal. But at the same time, we are talking about 21st century where everybody is worried about the next day. Nobody wants to take a sick leave. Nobody wants to miss any of their daily activities because of sickness. In this scenario, without medication of any form, it would be very difficult to say it would take care of a problem on itself. Now, these are acute problems. When we say acute problem, a problem which has happened in a day or two and you have developed an infection. Whereas somebody can have a recurrent problem, they can keep getting again and again, or they can have an infection which we call as chronic, something which can go on for months together. Now these, when they do not respond to the conventional medication, obviously they will not have a natural course where they would remedy themselves. In these scenarios, we will have to look at the possibility of surgery being an option. So only enlarged tonsil is not a very difficult proposition to live with. It would again boil down to whether the child has enlarged tonsils with adenoids causing obstruction. So obstruction means child will have difficulty in breathing. Parents actually come to us saying they see their child struggle to breathe. The child, when put to sleep, will be sleeping in a very abnormal posture, where the head can be turned into a very different angle which we would find most other human beings not able to achieve in regular sleep. So that the airway can open up. The child will be sleeping in such a position, mouth will be open, they will be tossing and turning throughout the night. Multiple times they will be getting up in the night. There have been instances where the child would even snort and stop breathing for a few seconds because of enlarged tonsils and adenoids. Now these are absolute indications for removal of adenoids and tonsils. If it is only tonsil which is enlarged, let's say whenever we ask the child to open the mouth, we see a tonsil which is a grade 2 or 3 and the child doesn't get repeated infections which is causing sick absenteeism in school. It is not causing any feeding problems, it is not causing any difficulty in breathing. Then we can have a watchful period of waiting and seeing how the child develops over the next year or so, whether it interferes with daily activity, school going, feeding, all these aspects. Only then a decision is made regarding surgery. Now, decision to make child undergo surgery is not a one-time consult. We would want to see the child a couple of times at least over a period of 6 months to a year. Then we will be able to see whether this child is a responder to medication, or is it just that the parents are getting panicky because of even regular common colds which these children are prone to get. So these are the things that will need to be assessed, and only then decision will be made to tell the child whether the child requires surgery or not. What are the symptoms of adenoid enlargement, and when do we say that the child requires surgery? Adenoids make an appearance at the age of 6 and disappear at the age of around 12-13. So when they get enlarged, they will cause nasal obstruction. That means child has difficulty to breathe through the nose. Child will have a constant symptom of cold on most days. Child will have snoring at night. Child will have mouth breathing. Child will take a long duration to eat food. Child may develop repeated ear infections, decreased hearing, fluid accumulation in the ear. And as the child grows older, the parents may start noticing that the teeth formation is becoming malaligned. Now all these things over a period of time observed for at least about 6 months to 1 year would determine whether the child would need surgery or not.